And first of all, Dr. Atchison, thank you so much for that very strong overview of an extremely rich and detailed paper that you and your co-authors developed. It has given us a lot to think about. It has opened up doors to the literature that you've reviewed and also to the programs that you've highlighted. So I'm delighted that we're able to use that as a foundation to really launch a discussion here. I would like to introduce our panel members. And first of all, let me just say what we're going to do right now is we're actually starting at the very high level of the systems level. And we're going to, throughout the day, be revisiting this theme, but we'll be looking, as Dr. Rozov has mentioned, at different aspects. So we'll be looking at ways systems encourage or discourage integration, and we'll begin to gain a better understanding of the ways in which health literacy is really a catalyst for integration. And that's sort of the centerpiece of our discussion, using the example of dental and medical integration. So our panelists include Anita Glicken. Let me tell you a little bit about Anita. She is the Associate Dean and Professor Emerita at the University of Colorado School of Medicine with over 30 years of administrative, research, and education experience. She's currently Executive Director of the National Interprofessional Initiative in Oral Health, and this provides the backbone support to a national movement to integrate oral health into primary care. She brings a wealth of knowledge from her direct management of international and national workforce models. And in the U.S., Anita has held several national leadership roles, including serving as president of the Physician Assistant Education Association and president CEO of the National Commission on Certification of Physician Assistants Health Foundation, where she led efforts to create a comprehensive database on certified PA practice. And this data set informs national health policy and workforce planning. Anita has served on several Health Resources and Services Administration advisory work groups to develop tools and resources that support national workforce research, education, and policy, including core oral health competencies for non-dental providers. And she is joined by Ron Inge, who's currently the Chief Operations Officer, Chief Dental Officer, and VP for Professional Services for Delta Dental Plan of Missouri. In this capacity, his responsibilities include all aspects of development and management of the dental and vision operations department, including claims and customer service. Dr. Inge is also responsible for the growth and development of the dental and vision networks, including clinical policies and procedures, quality management, and utilization review management. As Chief Dental Officer at Aetna, he led the initial data analysis that launched medical dental integration. He's also served as the Associate Director for the Division of Dental Practice at the American Dental Association, and served as the VP of Professional Services and Chief Dental Officer for Delta Dental of Washington. As the past Executive Director of the Institute for Oral Health, Dr. Inge has championed efforts to publicize innovative solutions to many of the current challenges to improving oral health. And to complete our panel, we have George Taylor. George Taylor is the Associate Dean for Diversity and Inclusion and is a professor in the Department of Preventive and Restorative Dental Services, Sciences, probably overseeing services as well, in the Division of Oral Epidemiology and Dental Public Health at the University of California, San Francisco School of Dentistry. He is a board-certified specialist in dental public health. He has served as a dentist in the U.S. Air Force for 4 years and has had a career in academic dentistry for over 35 years, teaching, conducting research, and providing patient care. He's taught, practiced general dentistry and dental public health, and conducted research. In his role as the Associate Dean for Diversity and Inclusion, he works to strengthen the School of Dentistry as a diverse and inclusive climate that empowers students, faculty, and staff to maximize their capacity in learning, working, serving, and growing together. And Dr. Taylor's principal research focus is on relationships between oral and systemic health. So very appropriately a centerpiece for our discussion today, particularly with a focus on periodontal infections and diabetes outcomes. Additionally, he actively mentors students, residents, and other faculty in their research careers. So I'm just delighted to have this panel with us today. They're extremely deeply experienced in multiple areas, but they are going to give us a diversity of views. So I'm going to pose a question and ask the panel members to answer from their own unique perspective as a beginning. So what do you see as a new path forward towards integrating oral health with general medicine, using health literacy as a catalyst, now that we have heard the background paper that was developed? Use your personal experiences. And George, I'm going to start with you because you're next to me.